What do you do briefly?
All right, thank you very much. When we talk about CEGRAD, we're talking about the Center for Gender Research and Documentation. Briefly, we are interested in gender research, which is a cross-cutting discipline. So whatever department you are in, there's a little bit of gender that you do. People are into women's studies in agriculture, women's studies in the arts, in law, wherever. So gender is CEGRAD is the hub of all these activities. So whoever you are and whatever department you are in, you would need CEGRAD to help you with your gender research. We also undertake advocacy training programs where we train people on gender issues, harassment issues, empowerment issues for both men and women. So we train students, we train staff, and we train people outside the university community as well.
Okay, so CEGRAD, we have a resource person today.
Right.
You take the opportunity to introduce the resource person and then we'll begin the discussion.
Thank you. So as part of our sensitization program, this month we are featuring Dr. Mrs. Obiri-Yeboah from the Department of
Midwifery,
Microbiology and Immunology.
Okay.
Right. And Dr. Mrs. Obiri-Yeboah is also the Deputy Director at DRIC. Right. And would like her to tell us something about women's health.
Okay.
As we know, this month, October, is Breast Cancer Awareness Month. It is good that we have her here to tell us something about what happens to our bodies as women.
Dr. Obiri-Yeboah, good morning.
Good morning.
I warmly welcome you to this morning's big platform. On that position at Drake, we are yet to celebrate. We are yet to celebrate, but congratulations to you.
Thank you.
We didn't hear much about it. It was just on some few platforms. And I told myself, Doc, this is not the way to go. you know, women will love to celebrate positions like this. And people, I will tell you more later in this week. Dr. Obiri-Yeboah, this morning we are looking at gynecological cancers. Why are we looking at this all-important issue?
Thank you very much. So, as we are focusing on women, there are certain conditions, disease conditions, that also are quite peculiar and unique to women. So when we talk about gynecological cancers, of course, it's a number of things that all affect the, let's say, reproductive system of women. But then, as people should be aware, this month, as mentioned, is a Breast Cancer Awareness Month. Of course, men have breasts also, but we all agree that really issues related to breast and its conditions affect women more than men. And so today we are focusing on cancers that are quite unique to women, and the two that will be highlighted will be the breast cancer and then cervical cancer, because these are really causing problem for our women.
So what are the cancers that, if we talk about women's health, you know, people need to keep in mind?
Yes. So as mentioned, for breast cancer and cervical cancer, they seem to come together and plan basically to kill
together to kill women.
Because every time you talk about them, you will hear that breast cancer is the number one cancer affecting women, the number one causing death among women. Immediately you move to a second position, you meet cervical cancer. So these two put together, if you look at the mortality, the death rate among women that is attributable to these two cancers, then it becomes a global issue, and actually is something that is receiving global attention, and developed countries have done a lot and are doing a lot, but we are also catching up, and that is why platforms like this to highlight what these are and how we could miss them is important.
I guess just to pick up, because we happen to be in the pink month, let's talk about breast cancer. You walk us through possibly the causes, and in Ghana, what's been the face of breast cancer over the years? What figures are we picking up? How are people's perception, you know, towards breast cancer and the readiness of our healthcare institutions in tackling them? If we talk about breast cancer, from your perspective, what's the simplest basic definition of it?
Okay, so this is a tumor, a cancer that develops in the breast of a woman. It starts in the breast. So I'm focusing on the word start because the cancer cells spread beyond the breast, and that is what is the problem we have in countries like Ghana, where a number of women, majority of women with breast cancer, are being picked when they have the cancer moving beyond the breast, so that managing it become very difficult, and even a lot of the time not very successful in the end. So we want to be able to pick breast cancer when it's just restricted to the breast and at very early stages. That is the whole idea.
Doc, the discussions that have gone on so far, a lot of people want to understand this disease condition, the cause of breast cancer. I mean, growing up in the village, growing up in the city, I saw women who just grew to their old age and died peacefully. Yet over the years, I don't know whether because the media is giving attention to it, that's why we seem to be hearing it a lot. But what is the particular cause of breast cancer? And if you look at Caucasian women, and let us know whether there are differences when it comes to women of color.
Okay. So for quite a while, people assumed and saw breast cancer as more of a disease for white women, let's put it that way. But in recent times, the dynamics is really not like that at all. The reasons are many, but of course it includes the fact that, like you said, we are now more aware, we are picking more cases, so it's coming up more that we are recognizing this. So yes, some of the women that might have died earlier in many years ago, that might have even had it might not have been diagnosed, and so they were not brought to the attention of people. When you ask the question of what causes it, that is one of the cancers that unfortunately is not something you can say this is just the cause, so if you dealt with that then you should be okay. No, there are many factors that we call risk factors, things that expose or increases a woman's risk of getting breast cancer. Some of them you cannot do much about it. For example, genetics. So there are genes that when they mutate, in simple terms they change in certain women, they put them at risk of getting breast cancer. So these breast cancer associated genes, the only thing a woman can do really is all come back to the issue of screening, so that you know whether you have that gene mutation and therefore you have a higher risk or not.
The gene mutation, is it triggered by any environmental factor or any behavioral,
So
issue?
This gene is one that we cannot say you got it because you got exposed to something specific. Of course, there have been some studies trying to look at environmental changes that might even contribute to this, so exposure to radiations and other things. But really, that is not the focus here. If a woman has that gene, I think the most important thing is to know whether you have that BRCA1 and 2 gene mutation and not and others. But the most important thing are the factors we can control as women. So for example, you cannot control your age much, but it is something that if you are aware that the older you get, from 40 years going, your risk of breast cancer goes up. The incidence of breast cancer is higher from that age. Then you would recognize why it is very important for women, particularly from 40 years, to make sure that you are screening for breast cancer. Okay. The other factors you can deal with are even issues related to lifestyle. For example, obesity, dietary factors, high alcohol consumption are all risk factors that have been associated with a higher chance of getting breast cancer compared with a woman of, let's put it, normal weight, not smoking, about.
So, Doc, the fact that you were a woman and you were taking in, alcohol, you are either smoking or you are obese, predispose you to having a breast cancer.
Your risk.
I see. And these are things that we can control. They are within our...
Exactly.
Okay.
So this morning, really, because of the time for this, my focus really is about this modifiable lifestyle issues, things you can deal with. And then the emphasis on screening. thankfully the breast is an organ that is outside, so you can't access it even by yourself. So that is why this month the highlight has been on self-examination by science over and over again, that it reduces the number of women who get breast cancer, because any changes, any lesions in their breast are picked earlier and then dealt with. So most of these ones do not even develop breast cancer, and even if it was breast cancer, they are able to treat it and get cured. So the highlight here is that as a woman, you should be interested in breast self-examination every month. And if you are not sure how to do it, that is where all the healthcare workers are available and can teach you easily how to stand in front of your mirror and do a complete breast examination every month.
Every month. Is there any
Once a month.
specific period within the month for any woman to do it?
No, so the what we highlight is that you should do the breast examination once a month, giving yourself a chance that if something had changed within a month, you would have picked it. A little lump had developed that wasn't there last month, you would have picked it. But in terms of what time of the month, of course, you know that during your menstrual period and ovulation, you know how the breast feels tender, less likely that you are going to be able to examine it well and those things. So you have to, if you are choosing a specific time to do it every month, then look at and make sure that you feel compared with the previous month.
And then for lactating mothers, how are they supposed to handle it? Because we know that at that time you may also not have a very, proper grasp of the breast. So how are they supposed to handle? What are they supposed to look out for?
So thankfully, breast examination screening for cervical cancer is not just the palpating. So aside that, we have actual investigations done in hospital. So you can have a breast ultrasound done, you can have a mammogram done in a hospital. These are all thankfully now readily available everywhere. So if we were speaking of Cape Coast, ultrasound is around you almost every facility. Mammogram, at least I know more than 2 places in Cape Coast that you can get a mammogram done. So these investigations are also available. So if at any point in time a woman's situation is such that breast self-examination may not produce the best result, the important thing is the awareness, so that this person also knows that he can visit a health professional, and based on the assessment that is made, the best way of screening her at that time or during that period would be discussed with her.
Doc, I had an encounter with a lady last year. I of course, after all the examinations, I said, I just want to be extra 100% sure, do the mammogram. They said, well, you don't qualify to do the mammogram. I insisted, and the mammogram breast cancer said, look, I have been examining my breast every month. And I don't know, some way, somehow, I didn't detect it. And now this cancer is at the advanced stage. For women who are listening to us this morning, as they do the breast examination, self-examination, what are they supposed to look out for?
Okay. So I think that's why I made a point that some women, they want to do it and they do it, but actually they are not doing it well, and that can be a reason for missing something. But aside that fact, you also know that this is a human touch issue, so you can still miss. That is why from certain ages, from the 40s, it's not that you do only the breast self-examination, but you speak to your gynecologist, you would have a time when you can actually get a mammogram or breast ultrasound also done from time to time, so that you are in a sort of schedule to follow. But during the time of self-breast examination, it starts that as a first clue. But aside that, when you touch also, some also miss certain parts. So you want to cover the whole breast, including the tail of it that goes into the axilla, the armpit.
Okay.
But some women miss that part. So if it turns out that that is where your examining, but you miss, and then when you have done, you still need to also press the nipple to look at discharging, any change in it, any change in color and other things. But some also miss that stage of actually pressing around the nipple to see if there is any discharge. So a lot of people think it's just an issue of touching the breast and looking for a big mass. Okay, but if you are doing this
See, and people, if you have any question, if there is any concern whatsoever regarding what we're discussing, please feel free. Dr. Dorcas Obriebo is here to offer all the explanations. The number is 0275 14 49 49, 0275 14 49 49. You're listening to The Breakfast Show on ATL FM 100.5. My guest in the studio is Dr. Dorcas Obriebo, and it's time with CEGRAD here this morning. We are talking about gynecological cancers, an important their interventions. For instance, the screening is done, and I'm asking this question because there are a number of women who say, well, I don't even want to go for them to find anything and come out to say they want to cut my breast. What are the interventions if a cancer is detected?
So those fears are what we need to also address. That everything is about early detection, and it's not everything that is detected in a woman's breast that is a cancer. So there are many people who pick lumps, and when they have come to the hospital and reported this lump, the investigation is done and we are able to tell them, oh, this is not cancerous. Based on the size and what it is doing, it may be removed still, and most of the time is removed, but then that is the treatment for it, that we found something. But if for removed per se. So those are the for a treatment with drugs that they had to swallow, in addition to maybe some minor surgery that didn't involve breast removal, and then they are fine. So
is listening to us this morning, I'm sure it's something that a number of people have heard it. Cancer of the cervix. Educate us, where is the cervix and whether this can easily be detected, like examining doing self-examination for breast cancer.
Okay, so I'll just do a quick comparison between breast and cervical cancer, then we see.
Okay.
So for cervical cancer, we know a cause, a main cause. It's an infection. That's as an infection. So that means that any attempt at picking it starts with recognizing if a woman has that infection. The cervix is simply put the mouth of the womb. Okay, so course, unlike breast that is easily accessible from outside, we cannot tell you to be examining your own cervix. You cannot see it. So with cervical cancer, the screening then require most of the time that you get to a health facility and have the testing done for you, and even the visualization of the cervix as an initial quick way of screening also require that somebody actually look at the cervix for you. So that makes a difference in there.
Doc, please clarify this. The visualization. So you're talking about the screening stage, not that, somebody should do the visualization for you at home. I just want to see whether it's something that any other lay person can pick up, by opening your vagina to say, I want to see the cervix. I can see there's a problem.
Well, you won't even see the cervix by just opening. So this is the visualization I'm talking about. Is a quick, easy way of screening, but it still has to be done by health professionals. Nurses are trained and many health professionals can do it. So it requires the woman to go and, of course, lie down. The cervix is assessed by passing a speculum, and then the health professional can look at the cervix. And there is a liquid that you can apply, acetic acid or iodine, applied just to paint, in quotes, the cervix, and then look at changes in color. And trained health professionals know what to look for. Areas of whitening and other things that would imply that is likely that something is changing at that point, in which case then again more samples would be taken for further analysis. The most important thing about these two cancers is that they do not have to kill you.
They do not have to kill you.
not have to kill you
But they
at all.
kill you.
But they are killing so many people, and that is what has to change. So it all been an issue of early detection, screening. But if you are not even aware that this is a problem to address, how many women walk about thinking about their cervix and what could be happening there as they are walking about? And that is what needs to change. That as a woman, men don't have to worry about their cervix. They don't have
have it.
So we have to think about it. That is part of us. It's a structure that by being a woman you have. And so we have to remember that it also gets sick, in quote, and make sure we find it early to be managed.
Doc, I want to understand, what put women at risk for, contracting cervical cancer. Is it just because they have it?
Okay. So I started by saying this time the cause is an infection, and this is a sexually transmitted infection. So again, coming back to breast cancer and the modifiable lifestyle issues with breast cancer, it also has to do with issues relating to safe sex practices, behavioral factors in terms of number of sexual partners, multiple sexual partners. So every one of those I've mentioned put you at a higher risk of getting the virus, HPV. And when you have gotten that virus, then depending on the type you have, and you didn't even know your cervix has this virus sitting there, over the years it gets the time it wants to change things in the cells of the cervix, and that is why gradually the cancer develops. Any symptom that you have this will only happen when you have advanced stages where the cervix is really, let me use the word, destroyed. The cancer has advanced, and now the woman will start talking about pain after sex, bleeding after sex, offensive discharges. At that point, you have developed a more advanced disease that the treatment then become more of an issue and very difficult, and also the outcome may not be as good as you want. But in the long phase where there is no symptom but the virus is just sitting there, there are many opportunities, if it was picked through screening, to do something about it so that doesn't become an issue that affects your life at all.
Doc, you mentioned one of the predisposing factors, multiple sexual partners. A woman says, look, I just have one sexual partner. What do you tell that woman?
So what is the HPV status of your one sexual partner? Do you know? So with HPV, thankfully in more recent times there is vaccination available against it. But for example, in Ghana, this vaccine is being just piloted here and there. The idea even of the vaccine is that a girl would take it before the person starts sexual activity. So these vaccines are usually given to girls between 9 years to 12 years, so that the idea is that they've not even gotten an exposure yet, and then they are protected from HPV. But even that, the vaccines available doesn't cover all the types of HPV that are available. So even a girl that was vaccinated, though she has reduced the risk of developing cervical cancer significantly, that risk is not eliminated completely, because there are other types of HPV. So your one sexual partner that you are thinking about, you do not know his status. That is why we come back to the same issue of screening. So going to screen whether you have cervical cancer is not something or pre-cancer lesions does not mean that you are saying you think that you've been having multiple sexual partners and so you have a risk. That is why. No, every woman who is sexually active should have cervical cancer screening, irrespective of whether it's been a one lifetime partner or a number.
Okay. Doc, I'm taking you back to breast cancer.
Okay.
Kwekuata says you're doing a great education. He's enjoying the program. And he says, please, in what way can men help the women in identifying breast cancer? I know why
that is a very popular question for men. So, well, we are talking about self-examination. So thankfully, the woman can examine their breast thoroughly if educated. But of course, partners can also help with this a lot. So thankfully, if you have a partner who also sort of know the should I say the nature of your breast, the shape of it, the how it feels in the hand, that person could also be the person who first spots a change or feels a lump. So yes, the male partners can also help, but this is not to give license to men to go out there saying
examining every breast,
free breast examination for us.
Examining every breast they meet in the street. Okay, so if you're a man, you're listening to us this morning, make sure your intention is truly to examine. If you don't know how to examine, please, you have no business there. What we're talking about, I mean, I'm sure it may be your own personal adventure. Anyway, let's briefly look at, Doc, the interventions. I think so far the knowledge is gone down there for every woman. Every woman from what age, if we're talking about cervical cancer?
Okay, so for cervical cancer, again, WHO advised from 25. But yes, because you get HPV very early in sexual activity. So
HPV, that's the
human papilloma virus. You get it very early in sexual activity. Most women get infected very early from their first sex going. So that is why they would recommend from 25. Some revisions will say 30, but whatever the case, it means that if you are from 30 going, you are already in that spectrum where you have to have screening done. So the screening, if it's the visual inspection with acetic acid, that is a one time you go, they look at it there and then you get the results. And if something is seen, they take the sample there and there. You have an idea how your cervix looks. But that can miss some of the lesions. That is why there are other things. And the commonest one we keep talking about is the pap smear, where they now take the pap smear. Of course, that one will require that you come back for the result, because you can't read the pap smear there and there. You can't stay in and read the result and give it to you. But they have to come back. But we even see that there are a number of women whose pap smear results have come in are there and they are not coming back even for it. But all come back to how much value you are placing on the screening and how aware you are. So opportunities come and they get the pap taken and they don't come back for the results even. So these are all reasons why we recognize that there is still a bit of a knowledge gap, awareness gap that needs to be filled for women to recognize they need to address this. You find people's attitude change only when, unfortunately, a family member or a friend's family member, woman, gets cervical cancer with bad poor prognosis, and then you see that this person, but no, we cannot all wait to have a personal experience of a friend or a family member.
Maybe too late. It's not the best.
It's not a good way to go.
It's not. Dr. Gina Odro says, good morning. I'm an interesting discussion this morning. We'll be happy to know if endometriosis in women has anything to do with cervical cancer. Briefly.
All right. So I think I can answer by saying what endometriosis is first. So the endometrium is the lining of the womb. The lining. That is the layer we shed off during menstruation every month. Some people have this lining actually also located in other parts of their body that is not the uterus. So some may get it in an ovary. Some may get it actually sitting on the cervix outside and other parts of the body. That is what we call endometriosis. And wherever this endometrium tissue appears, it behaves like the way you should shed it every month in the menses. So that causes problems. So it has its own problems that it brings about. That does not necessarily relate to cervical cancer development. But of course, this is also an abnormal tissue, abnormal in the point of where it is located, which shouldn't have been.
Doc, our time is up. Unfortunately, we seem to have a lot of questions coming in. Kwekwata says, is the treatment of cervical cancer covered by NHIS? Yes, no?
Unfortunately, not yet.
Not yet. So, Brother Kwekwata, thanks a lot for writing to us. And the other questions, unfortunately, our time is up. Dr. Obriyebo, we appreciate your presence here. Dr. Addai-Mununkum, thank you very much for facilitating this discussion. And I hope that we pick something quite similar, knowing the kind of questions that are coming. Yeah. Ladies, thank you very much for gracing this morning's program.
Thank you for the opportunity.
All right, people, stay with us. We've got other very important engagement coming up. I'm talking about in the way of